How an epidural is given. An epidural is an injection into your lower back that temporarily blocks pain from your waist down. You'll be asked either to lie on your side with your knees tucked into your chest or to sit upright and lean forward. This opens up the space between the bones in your spine. Your anaesthetist will carry out your epidural in 2 parts. Firstly, a small amount of local anaesthetic is injected into your skin to completely numb the area. Then, a hollow epidural needle is given into your epidural space. This is the space just outside the membranes that surround your spinal cord. When the epidural needle reaches the correct spot, your anaesthetist will thread a very thin plastic tube through the center of the hollow needle. They'll then remove the epidural needle, leaving just the tube in place. The tube will run from inside your epidural space to the outside of your body. It's secured using adhesive tape and used by your anaesthetist to give you medicines for pain relief when you need them. Your anaesthetist may also attach a pump to the tube, so you can top up your pain relief when needed, and sometimes you'll be able to control this yourself. When you no longer need pain relief, the tube will be carefully removed and the area covered with a plaster.